Medical coding might seem like a foreign language, but it's the backbone of healthcare administration. It's how medical professionals communicate diagnoses, treatments, and procedures to insurance companies. Accurate coding ensures proper billing and reimbursement. This essay focuses on skin and subcutaneous tissue, a complex system crucial for coders to understand. Accurate coding relies on a deep understanding of medical terminology, anatomy, and procedures. This knowledge allows coders to translate complex medical information into standardized codes. These codes paint a clear picture of the patient's condition and the care they received. Mastering this system is vital for efficient healthcare delivery and accurate financial transactions. Let's break down some common terms. Epidermis, the outermost layer of your skin, acting as a waterproof barrier. Dermis, the middle layer, containing blood vessels, nerves, and hair follicles. Subcutaneous tissue, the deepest layer, made of fat and connective tissue. Lesion, a general term for any abnormal change in skin tissue. Biopsy, removing a small piece of tissue for examination under a microscope. Understanding these terms is just the first step. Medical coding involves countless abbreviations, acronyms, and specialized vocabulary. For example, BCC stands for basal cell carcinoma, a type of skin cancer. Mastering this language is essential for accurate coding. Your skin is your body's largest organ, acting as a protective barrier against the environment. It shields you from harmful elements like bacteria, chemicals, and temperature extremes. This remarkable organ is not just a simple covering, it plays a crucial role in your overall health and well-being. The epidermis, the outermost layer, is constantly renewing itself, shedding dead cells and replacing them with new ones. This process, known as cell turnover, ensures that your skin remains fresh and resilient. The epidermis also contains melanocytes, which produce melanin, the pigment responsible for your skin color. Beneath the epidermis lies the dermis, a complex network of blood vessels, nerves, and glands. This layer is vital for sensation, as it contains nerve endings that allow you to feel touch, pain, and temperature. The dermis also houses hair follicles and sweat glands, which help regulate body temperature and excrete waste products. The dermis gives your skin its strength and elasticity. Collagen and elastin fibers within this layer provide structural support and flexibility, enabling your skin to stretch and return to its original shape. This elasticity is crucial for movement and protection against physical stress. The subcutaneous tissue located below the dermis acts as insulation and cushioning. This layer helps to maintain your body temperature by providing thermal insulation and serves as a shock absorber, protecting your internal organs from trauma. This layer is primarily composed of fat cells and connective tissue, providing a protective padding for your internal organs. The fat stored in this layer also serves as an energy reserve, which your body can utilize during times of need. Understanding the structure and organization of these layers is essential for accurate medical coding, especially when dealing with procedures or conditions affecting specific skin depths. Accurate coding ensures proper diagnosis, treatment, and billing, which is crucial for patient care and healthcare management. Your skin and subcutaneous tissue do more than just cover your body. They play a vital role in your overall health. The skin regulates your body temperature, acting as a thermostat to keep you cool or warm. It also acts as a sensory organ, allowing you to feel touch, pressure, temperature, and pain. The subcutaneous tissue provides insulation, helping to regulate your body temperature and protect your internal organs from impact. It also stores energy in the form of fat, which can be used by the body when needed. Understanding these functions is crucial for coders, as skin conditions can have far-reaching implications for a patient's overall health. When things go wrong, our skin can be vulnerable to various diseases and conditions. The skin, being the largest organ of the body, serves as the first line of defense against environmental factors. However, it is not invincible. Various internal and external factors can lead to a range of skin and tissue problems that can affect our overall health and well-being. For instance, acne is a common condition that causes pimples, blackheads, and whiteheads. It primarily affects teenagers, but it can also persist into adulthood. Acne occurs when hair follicles become clogged with oil and dead skin cells, leading to inflammation and sometimes infection. Treatment options vary from over-the-counter creams to prescription medications, depending on the severity of the condition. Eczema is a group of conditions that result in itchy, inflamed, and irritated skin. It is often linked to genetic factors and can be triggered by environmental elements such as allergens, stress, and irritants. Managing eczema typically involves moisturizing the skin, avoiding triggers, and using prescribed medications to control flare-ups. Psoriasis is a chronic condition characterized by thick, scaly patches of skin. This autoimmune disorder accelerates the life cycle of skin cells, causing them to build up rapidly on the surface. Psoriasis can be painful and sometimes debilitating, requiring a combination of topical treatments, phototherapy, and systemic medications to manage symptoms effectively. And then there's skin cancer, which is the abnormal growth of skin cells, often due to sun exposure. Skin cancer is the most common type of cancer, and it includes basal cell carcinoma, squamous cell carcinoma, and melanoma. Early detection and treatment are crucial for a better prognosis, and preventive measures such as using sunscreen and avoiding tanning beds can significantly reduce the risk. Each of these conditions has specific symptoms, causes, and treatments. Understanding the nuances of these skin problems is essential for accurate diagnosis and effective management. Dermatologists play a key role in identifying and treating these conditions, often working closely with patients to develop personalized care plans. Accurate coding requires understanding these nuances. Medical coders must be well-versed in the various skin conditions and their respective treatments to ensure that patient records are correctly documented. This accuracy is vital for insurance claims, treatment plans, and overall patient care. For example, coding for acne treatment is quite different from coding for skin cancer treatment. Each condition has its own set of codes that reflect the specific diagnosis, treatment procedures, and follow-up care required. This detailed coding helps in tracking patient outcomes and improving healthcare services. It's not just about identifying the condition, but also understanding its severity and the complexity of the treatment provided. Comprehensive documentation and coding ensure that patients receive the appropriate care and that healthcare providers can monitor and adjust treatment plans as needed. This holistic approach is essential for managing skin and tissue problems effectively. Doctor's orders procedures for skin and subcutaneous tissue. These procedures are essential for diagnosing, treating, and managing various skin conditions and subcutaneous issues. They play a crucial role in both medical and cosmetic fields, ensuring patients receive the best care possible. Medical procedures for skin and subcutaneous tissue range from simple to complex. These can include minor treatments like mole removal to more intricate surgeries such as skin grafts and liposuction. Each procedure is tailored to the patient's specific needs and medical condition. Excision involves surgically removing a lesion or a portion of skin. This procedure is often used to treat skin cancers, cysts, and other abnormal growths. The excised tissue is usually sent to a lab for further analysis to ensure complete removal and to check for any signs of malignancy. A biopsy is the process of extracting a small tissue sample for microscopic examination. This is a critical diagnostic tool used to identify various skin conditions, including infections, inflammatory diseases, and cancers. The results from a biopsy can guide the next steps in treatment. Skin grafting entails transplanting healthy skin to cover a wound or burn. This procedure is vital for patients with severe skin damage as it promotes healing and reduces the risk of infection. Skin grafts can be taken from the patient's own body or from a donor, while liposuction is the surgical removal of excess fat from the subcutaneous tissue. This procedure is often used for body contouring and can significantly improve a patient's appearance and self-esteem. It requires careful planning and precision to achieve the desired results. Each procedure has unique codes representing its complexity and the specific area treated. Accurate medical coding is essential for proper billing and insurance claims. It ensures that healthcare providers are reimbursed correctly and that patients' medical records are precise. For example, coding for a biopsy on the face differs from coding for a biopsy on the arm. The location of the procedure can affect the complexity and the reimbursement rate. Coders must be meticulous in documenting the exact site and nature of the procedure. Coders must be familiar with anatomical locations, surgical techniques, and the specific instruments used to ensure accurate coding. This knowledge helps in maintaining the integrity of medical records and supports the overall healthcare system in delivering quality care to patients. Healing from within. Medications for skin and tissue conditions. Various medications treat skin and subcutaneous tissue conditions. Topical corticosteroids reduce inflammation and itching. Antibiotics are used to treat bacterial infections. Antivirals target viral infections, and antifungals combat fungal infections. Coders must be familiar with drug classifications, administration routes such as oral, topical, and injection, and dosage forms like creams, ointments, and pills. Understanding these details ensures accurate coding for medications and their associated costs. Case study, putting it all together. Let's imagine a patient presents with a suspicious mole. The dermatologist performs a biopsy, which reveals melanoma, a type of skin cancer. The dermatologist then performs an excision to remove the cancerous tissue. The coder must accurately capture the diagnosis, which is melanoma, the procedures, which include the biopsy and excision, and any medications prescribed. This example highlights the interconnectedness of medical knowledge and coding. Accurate coding relies on understanding the patient's journey from diagnosis to treatment, including all procedures and medications involved. It's about painting a complete picture of the patient's encounter with the healthcare system. Conclusion: your skin in the game, medical coding mastery. Mastering medical coding for skin and subcutaneous tissue is crucial for accurate billing, efficient healthcare administration, and ultimately, patient care. It's not just about memorizing codes, it's about understanding the intricate workings of the human body and the complex language of medicine. By continuously learning and staying updated on industry changes, medical coders play a vital role in the healthcare system.